Located along the Kabale-Mbarara highway, Kakatunda Health Center III stands in Muhanga Town Council within Rukiga district. The health care facility was initiated by the Catholic Diocese of Kabale. Remarked Tibabigyemwa, the in charge of this health facility, has highlighted the challenges they currently face. These include the absence of crucial equipment like X-ray and scanning machines, as well as the unavailability of an ambulance. Furthermore, the limited space of the maternity ward compounds their difficulties. According to Tibabigyemwa, the facility receives 10 patients seeking X-ray services, 40 patients for scan services, and around 60 expectant mothers make deliveries monthly. During a fundraising event held on Sunday at Kakatunda Playground in Muhanga Town Council, Rukiga District, Remarked Tibabigyemwa described these challenges. The occasion aimed to raise funds for the construction of an 80-bed capacity maternity ward, procurement of an ambulance, and acquisition of an X-ray and scanning machines. This community initiative showcases their collective determination to obtain vital medical equipment.
The challenge we have been having is because we have been having many deliveries at the facility, and the space that we have now is very small, is limited. So that's why we want to enlarge or to increase the size of the building so that we can have a big building which can accommodate every person in the maternity at our facility. Another thing, the challenge we have been having is we have many people to refer, many people who need a scan. How many people have complaints that we cannot rule out with our eyes and they need scan. So that's why we are saying that we need this equipment in our facility so that it can help us to treat our patients very well, because we have a lot of patients that we are referring around every day. We are referring about 10 for X-ray. We are referring about 40 for scan. So that is a big number.
Tibabigyemwa remarked that these difficulties have compelled pregnant mothers and other patients utilizing the health center to embark on lengthy journeys to reach Kabale Regional Referral Hospital for the required services. This situation persists despite the health facility's strategic location along the prominent Kabale-Mbarara highway. The health center attends to an average of over 100 patients daily, a considerable portion of whom are accident victims.
We have many mothers, antenatal mothers. In the Rukiga district, we are the best ones. In the deliveries, we are the best ones. And every mother needs to be having a scan as equipment results. So that's why we need all of these equipments that will help us. Sometimes they bring for us emergencies. We are on highway. They bring for us many people. Police brings for us. The district brings for us. So there are many people who bring for us emergencies, which even we cannot handle. Like they need to be referred to Kabale, some need to be referred to Mbarara, but we don't have the right means of transport.
Tibabigyemwa mentioned that although the health center currently possesses a 30-bedroom capacity maternity ward, it consistently attends a monthly influx of 50 to 60 expectant mothers. Coupled with a limited space, the existing building falls short in accommodating the demand. He also emphasized that the forthcoming maternity building is designated to accommodate a total of 80 beds, significantly enhancing their capacity to serve the community's needs.
We have been having roughly 50 mothers per month. So now, but our bed capacity, we have only 30. So that means we are left with 20 beds, which needs to be put in that building, and that building is very small. So that's why we want to enlarge, so that antenatal becomes postnatal becomes alone, antenatal becomes alone, so that we have a big space. We have those beds, because the broker that we are going to put there, that we are going to construct, has now 80 beds.
Reverend Father John Byamukama, the parish priest of Kakatunda Catholic Parish, revealed that the entirety of the necessary resources for meeting all the requirements amounts to 207 million Uganda shillings.
Kandi niza kubahereza ukurugira okumwisha nirwaro ryekerezia nahabwecho nirwaro rya buryomwe njo tukurondera ubuyando bya mutubaze kwiteka amusinje gwetoreni mwahora mutwenda miliyoni 2 mushanju kumarirwa rere tibikumanya twakanga kikungare bija kutugambira tureze kusigarayo.
Honorable Karen Kamsime Mwezi, the Rukiga District Woman MP and chairperson of the organizing committee, made a substantial contribution of 10 million Uganda shillings to support the construction of the maternity ward. In a conversation with our reporter, Jacqueline Kamushaba, the Muhanga Town Council LC5 councillor, who represented the woman MP, noted that the facility serves as a net worth international health center due to its strategic location along the Kabale-Mbarara main road.
Kakatunda Health Center III it is an international health center because it helps those who get accident in this highway road. They first get first aid here and then get referral to other hospitals. So I think if we can raise some money and we buy x-rays, scans, and ambulance, it can help our Rukiga, it can help Uganda.
The Rukiga County MP Ron Bish, who graced the occasion as the chief guest, made a significant contribution of 5 million Uganda shillings and additionally procured a cow herd for 3.5 million Uganda shillings. Gyamujanye noted that due to the health facility's advantageous positioning, it draws in a considerable volume of patients, encompassing those undergoing tests, individuals involved in accidents, among others. Furthermore, he encouraged the general public to prioritize regular medical checkups, even in the absence of illness, underscoring the importance of such practice for the improvement of their overall well-being.
This health facility that we are talking about, that we have been fundraising for, is a very strategic one. First of all, it is central. It is near the road, main road. People from Ndorwa, people from Ntungamo, and other surrounding areas, they come here to seek for help, especially when they are sick. But it's also important that for preventive measures, for people to really do tests, to know how their bodies are functioning, it's also very important. And that's one of the areas that we want to emphasize, that people should come to the health center, not only when they are sick, but even when they are not sick, but they want to test.
During the event, the participants managed to gather an impressive amount, including over 60 million Uganda shillings and 17 bags of cement. Norbert Ngamachi for Kigezi Television.